Paxlovid. Paxlovid is the first U.S. FDA-approved oral antiviral for treatment of COVID-19 in adults. Let's take a look at what it is and how it works. What is Paxlovid and how does it work? What is Paxlovid? Paxlovid is a new oral medication that combines two drugs, nirmatrelvir and ritonavir. How does it work? Nirmatrelvir and ritonavir work together to inhibit the replication of SARS-CoV-2, the virus that causes COVID-19. Who can take Paxlovid? Paxlovid is approved for use in people who have tested positive for COVID-19, are at high risk for severe disease, and are not hospitalized or require supplemental oxygen. Clinical trials and efficacy. Clinical trials. Paxlovid underwent clinical trials that showed it to be effective in reducing hospitalizations and deaths in people at high risk of COVID-19 complications. Efficacy. In clinical trials, Paxlovid has been shown to reduce the risk of hospitalization and death by up to 86% when taken within 5 days of symptom onset. Adverse effects. The most common side effects of taking Paxlovid include impaired sense of taste and diarrhea. Side effects and safety concerns. Other side effects. Adverse reactions identified during post-authorization use of Paxlovid includes hypersensitivity reactions, headache, hypertension, abdominal pain, nausea, vomiting and malaise. Safety concerns. Although Paxlovid has been shown to be effective and safe in clinical trials, long-term safety data is limited, and more research is needed to fully understand the drug's safety profile. Drug interactions. Paxlovid includes ritonavir, a strong CYP3A inhibitor. May lead to greater exposure of certain concomitant medications, resulting in potentially severe, life-threatening, or fatal events. Co-administration with potent CYP3A inducers. Significantly reduced nirmatrelvir or ritonavir plasma concentrations may be associated with the potential for loss of virologic response and possible resistance. Prior to prescribing Paxlovid, please review all medications taken by the patient to assess potential drug-drug interactions and determine if concomitant medications require a dose adjustment, interruption, and/or additional monitoring. Consider the benefit of Paxlovid treatment in reducing hospitalization and death, and whether the risk of potential drug-drug interactions for an individual patient can be appropriately managed. Other warnings and precautions. Hypersensitivity reactions. Anaphylaxis, serious skin reactions, including toxic epidermal necrolysis and Stevens-Johnson syndrome, and other hypersensitivity reactions have been reported with Paxlovid. If signs and symptoms of a clinically significant hypersensitivity reaction or anaphylaxis occur, immediately discontinue Paxlovid and initiate appropriate medications and/or supportive care. Hepatotoxicity. Hepatic transaminase elevations, clinical hepatitis, and jaundice have occurred in patients receiving ritonavir. HIV-1 drug resistance. Paxlovid use may lead to a risk of HIV-1 developing resistance to HIV protease inhibitors in individuals with uncontrolled or undiagnosed HIV-1 infection. Pregnancy and lactation. Pregnancy. Available data on the use of nirmatrelvir during pregnancy are insufficient to evaluate for a drug-associated risk of major birth defects, miscarriage, or adverse maternal or fetal outcomes. The estimated background risk of major birth defects and miscarriage for the authorized population is unknown. Lactation. There is no information on the effects of Paxlovid on the breastfed infant or the effects of the drug on milk production. The developmental and health benefits of breastfeeding should be considered along with the mother's clinical need for Paxlovid. Any potential adverse effects on the breastfed infant from Paxlovid or from the underlying maternal condition. Dosage and administration. Paxlovid is available in tablet form containing tablets of nirmatrelvir 150 mg and ritonavir 100 mg. Initiate Paxlovid treatment as soon as possible after diagnosis of COVID-19 and within 5 days of symptom onset. Dosage. 300 mg nirmatrelvir, 2 150 mg tablets, with 100 mg ritonavir, 100 mg tablet, with all 3 tablets taken together twice daily for 5 days. Dose reduction required in patients with moderate renal impairment. eGFR is greater than or equal to 30 to less than 60 ml per minute. Paxlovid is not recommended in patients with severe renal impairment. eGFR less than 30 ml per minute. Paxlovid is not recommended in patients with severe hepatic impairment, Child-Pugh Class C. Comparison with other COVID-19 treatments. Paxlovid versus remdesivir. Paxlovid is an oral medication that can be taken at home, while remdesivir is an intravenous drug that must be given in a hospital setting. Paxlovid versus monoclonal antibodies. Paxlovid is taken orally in pill form, while monoclonal antibodies must be given as an intravenous infusion. Paxlovid versus vaccines. Vaccines are the best way to prevent COVID-19, while Paxlovid is used to treat people who have already been infected with the virus. Conclusion and future developments. Pros. Paxlovid can be taken at home. Reduced risk of hospitalization and death for high-risk individuals. Combination drug that fights COVID-19 in a different way than other treatments. Cons. Limited availability. Expensive. Preliminary long-term safety data. Paxlovid is an important addition to the arsenal of treatments against COVID-19. As more data becomes available about the drug's safety and efficacy, we will likely see its use expand to a wider population of people. In the meantime, it is important that we continue to follow public health guidelines to prevent the spread of COVID-19. This video is intended for informational purposes only and should not replace professional medical advice. Always consult a healthcare provider for personalized guidance. Thank you for watching. Please like, share and subscribe.